You're telling me that a kid can go to a public school, take off the kid's shirt and put on a dress, go to the girls' room when he's a boy, and then change his name from John to Tiffany?
Correct,
That's
because sometimes
insane.
5-year-olds are now exposed to what is transgender. Hey, mommy, what is transgender? Am I transgender? It's very scary. Slippery slope.
Can you imagine now the boys want to go into the girls' bathroom and the girls wanted to go into the boys' bathroom and they can just say, oh, well, I was transgender for the moment. I mean, it's just going to cause, teachers are already overburdened.
The transgender woman was attacked and the entire thing, very disturbing, was caught on tape.
The vicious attack escalated when they realized she was a transsexual.
In her mind, she was always a woman.
Yes,
See, in my mind, I was
know.
always a quarterback for the New York Jets, so I don't know how much credence to put in that. I mean, she wasn't born that way.
Transgender teenager will have to spend the night in the hospital after getting stabbed in the back.
A number of witnesses told detectives that they heard the suspect taunt that 15-year-old transgender woman for being transgender. The charges of assault with a deadly weapon can now be included with the district's enhanced hate crime penalty.
Man on the top and the skirt on the bottom. We're all a little confused by it.
The craziness is called the Transgender Equality Law. Here's how insane you are and this whole thing is, all right? And this is truly madness, ladies and gentlemen.
This is a recognized mental illness.
Sick.
Madness?
Trannies. Disgusting freak. Bias. Hatred.
clowns.
Hate crime.
God hates transgender people.
A person's sex, it is what you are at birth.
People are encouraged to express their true character, to soar above the limitations of others' judgments. During youth, this advice colors the world more brightly, embellishing life with a rich array of shades. But the hues fade as the realization that society is woven by contradiction sinks in. The beauty of human diversity is too often confined, limited by human ignorance, animosity, and fear. As progressive as today's culture appears, transgender people are denied basic human rights and are often forced to live without safety, dignity, and justice. Although immense progress has been made, work remains to be done to advance the transgender human rights agenda. To protect the human rights of one of the most marginalized people in society, education, the eradication of the stigma which limits transgender people, the provision of full healthcare access, and the establishment of fair legal platforms are crucial. It is vital for all members of society to redouble their efforts and commitment to securing human rights for all. The injustices transgender people face often stem from societal ignorance and misunderstanding, as well as the fear of unknown territory.
It can be really hard and pretty emotionally draining.
Although the visibility of transgender issues is on a steady incline, widespread comprehension of the topic remains rare. In order to fully understand gender dysphoria, it is imperative to correct the misinterpretations regarding anatomical sex, gender identity, and sexual orientation, as well as to eliminate the conceptions that being transgender equates to having a mental illness or having a choice. In this and any case, education is the most powerful weapon to change the world. Anatomical sex, gender identity, and sexual orientation are individual components that are commonly mistaken for one another. Guiding people to make these distinctions is crucial, as misunderstanding breeds significant challenges to the transgender community.
Biological sex is what you're born with. It's whether you have a penis or a vulva, or neither, or a combination of both. That's just biological sex. It's your body. Gender identity, it's how you feel, what you know yourself to be inside. Sexual orientation has nothing to do with gender identity or gender. It's who you're attracted to. And it's who I want to have an emotional and physical relationship with. So it's all about attraction. It's really about who you're attracted to.
Comprehending that gender is not inherently connected to one's bodily anatomy is arguably the hardest idea for disputants to overcome. Once this idea is fully grasped, the confusion behind gender dysphoria subsides. So what is gender dysphoria?
Gender dysphoria is certainly a medical condition.
a medical condition where a person's brain sex is not consistent with their physical manifestation of who they are as male or female. And for many people, it does require medical treatment, including medication or surgery, to allow them to have their body conform to their brain sex.
Gender isn't binary. It isn't just male and female. And the transgender folks on that spectrum are in between at various levels. We treat everyone as if they were all heterosexual and cisgender, and they're not.
Because it has anything to do with a person's brain, doctors have sometimes thought of it as a mental health condition. But a person who has that inconsistency is not disordered or dysfunctional in any way. They just need to actually have their body physically treated to conform to their brain sex. So I think it's much more appropriately understood as a physical condition rather than a mental health condition.
There's just been a change in the psychiatric literature that gender dysphoria is now not gender identity disorder, so it's not a mental disease anymore. But up until the DSM-5 came out, it was considered a mental disease. It's not a mental disease at all.
The medical realm defines a psychological state as mentally disordered if it causes significant distress or disability, both of which transgender people do not experience due to their gender identity. Obstacles preventing transgender individuals from freely expressing their gender identity, such as lack of societal acceptance, discrimination, or assault, are the true origins leading to anxiety, depression, or related disorders. There are countless arguments regarding the nature of being transgender. Many researchers are trying to prove that it's genetics. Others argue it's caused by hormonal imbalances in the womb, while other studies indicate that gender identity may be directly associated with brain anatomy. Although some believe it is a social choice that should not be afforded special rights, most agree that it is most likely determined before we are born.
It's not a choice. What day did you decide that your gender was female? You didn't. You just were. Anybody should be believed and treated and taken seriously.
Amidst the myriad of abuses the transgender community are forced to endure are social injustices. Discrimination, hate crimes, and limited access are all harsh realities being imposed onto the lives of transgender individuals. Due to the prevalence of transphobia and cissexism within our society, discrimination invades every facet of the lives of those who do not conform to gender norms, including the workplace, school settings, and medical environments.
We, in so many different areas of society, really expect people to look and conform to gender norms, and when they don't, they face significant discrimination simply for being who they are.
One of the big issues is that transgender people are widely unemployed and vastly underemployed. And what I'm always left thinking about is the fact that there's a loss. There's a loss for the person who faced discrimination, but there's also a loss to that workplace.
These rates prove the clear violation of the human rights stated in Article 23 of the Universal Declaration of Human Rights. Everyone has the right to work and to protection against unemployment.
Many transgender people who are overqualified for positions submit resumes, are invited to come in for interviews, and then are never called back.
I would speak to the recruiters and I would say, it's very important that you understand that I plan on coming to this company as a woman and I'll interview that way, even though all of my prior experience as a man. It was only one company that went beyond that first recruiter call.
Nobody should be asking, so exactly which gender are you? They should be asking behavioral-based or job-related questions or things that are legally acceptable.
It's very difficult to pursue an employment discrimination case when that happens because there's so many reasons why an employer can just say, well, we just weren't interested. It wasn't the right fit for us. That's why we have to really have this multi-pronged attack where we, at the same time, secure legal protections, but also work to shift the entire mindset.
Tragically, discrimination is a fact of life for transgender youth as well. They are largely harassed and subjected to violence without any meaningful recourse. According to a survey by the Gay Lesbian Straight Education Network, 1/3 of transgendered youth have attempted suicide due to the stigma surrounding their identities.
Those rates are also significantly impacted by the lack of family acceptance for many young people. What we know is that if we can get families to understand that the most important thing that parents and extended family members can do is to love and support their children, that we can change those rates. And it really does start with the close group of people who young people look to support them.
Parents have to go through their own transition.
Developing strong systems and environments free from harassment and violence around these young people is vital for ensuring their healthy future. The human rights of transgender students must be ensured through
education is key, top-down policy protections, having the leadership both at the local and the state level recognize the importance of affirming all youth in schools, and adopting the kinds of policies that answers questions that schools may have about how to ensure fairness, inclusion, and affirmation of transgender students.
In addition to implementing these policies, it is essential that staff members be trained on the importance of affirming and including transgender youth. The prevalence of hate crimes against transgender people further evidence the social injustice within present societies. Although transgender people constitute approximately 10% of the LGBT community, they account for a shocking proportion of its hate crime statistics, with trans people nearly twice as likely to be threatened as their LGBT peers. Of the 25 reported anti-LGBT homicides in 2012, according to the National Coalition of Anti-Violence Programs, transgender people accounted for more than half of the victims. Disturbingly, transgender murders tend to be gruesome, often involving torture and mutilation, such as 37-year-old Brandy Martell, who was shot in the genitals, or the brutal hatchet slaying of 31-year-old Diamond Williams. These forms of discrimination violate Articles 3, 5, and 12 of the UDHR, which respectively state, "Everyone has the right to life, liberty, and security of person. No one shall be subjected to torture or to cruel, inhuman, or degrading treatment or punishment, and no one shall be subjected to attacks upon his honor and reputation." The inferior rank of transgender people is blatantly obvious, as evidenced by the limitations to access to basic facilities in society. The bathroom ordeal remains as a significant issue for the transgender community, due to the general public's incapacity to accept the validity of these individuals' identities.
I strongly believe there will be cases of rape.
We will not be told how, when, and where to raise our children.
Transgender individuals deserve the right to access to facilities appropriate to their true gender identity, as well as to live without others calling into question their identity on a regular basis. Transgender people also face significant restrictions to healthcare access. Anxiety, depression, and suicide rates within the transgender community are astronomical. The necessity for easy access to mental health care is clear. However, these individuals face significant issues, including finding affordable resources, such as professional counseling.
One of the areas where people are really impacted is the fact that health insurance excludes most of the kind of medical treatment that people need.
An increasingly controversial and complex conversation regarding this topic deals with access to physical health care. There is an ongoing debate concerning whether the many external operations that transgender people undergo should be covered by insurance plans, public or private. Similarly, gender-affirming surgery is a colossal ongoing debate. Many consider the procedure to be cosmetic and unnecessary, instead of as a medical necessity or a means of aligning one's physical body to one's true gender identity.
I contend that this surgery is not cosmetic, rather vital to trans people living fully in their bodies. It's vital to their mental health and contributes to assisting trans people in having lives worth living in the bodies they've always felt were their identity.
The medical community has really reached consensus that gender-conforming surgeries for transgender people are medically necessary.
The American Medical Association, the American Psychiatric Association, the American Psychological Association, the American Academy of Family Physicians, the American Congress of Obstetrics and Gynecologists, the Endocrine Society, the National Alliance for Social Work, and the World Professional Association of Transgender Health all agree, as has every court to consider the issue, that this is a vital extension for folks in that process of gender reassignment.
Transitioning is a life or death situation for many people.
Many resort to substance use and or suicide as a way out of an alien body and an existence which feels irreparable. Trans people feel the only way out of this dysphoria is to end their lives, and without hope, many choose to commit suicide.
I certainly have people in my own life and in my work who I have seen harm themselves because of lack of access to the possibility of transition.
In order to decrease the depression, anxiety, and suicide rates within the transgender community, society must realize the importance of affirming the identities of these individuals. Ignorance, animosity, and the mere reluctance to increase budgeting for these treatments stunt progressive conversations concerning this particular issue.
Transgender exclusions in health insurance plans is unlawful discrimination.
It is simply rank discrimination that results in insurance plans providing those kinds of treatments like hormone therapy for someone who is not transgender, and then excluding and denying it for someone who is transgender. And that's wrong.
People say, well, God doesn't make mistakes. Well, people were born with birth defects. Lots of trans folks feel it's a birth defect. I think it's a matter of life and death. It's a public health issue. And of course it should be covered by insurance.
In the context of private insurance, you shouldn't be denied health care simply because you're transgender when your non-transgender coworkers are receiving the health care for their essential medical needs. And certainly on the public side, nobody should be targeted for an exclusion for medical care based on who they are and an unchangeable piece of their identity.
It's a matter of human dignity to allow people to live their lives in the gender that they identify with.
Yes, a growing number of government agencies agree with us that transgender health exclusions are impermissible, but now our healthcare systems have to catch up. Because even without these categorical exclusions, we know that transgender people risk biased decision-making. And even once we ensure coverage for basic care, we have to ensure that there are doctors, hospitals, and beyond who stand ready to provide this necessary care to our community.
In order to inspire positive change throughout society, there must be justice for the transgender community in current and future legislation. It is mandatory that legislation is passed to establish strong legal protections for transgender people, primarily in areas regarding social equality, healthcare access, and legal documentation. The eradication of discrimination against the transgender community must first be implemented.
There needs to be really broad state policy that confirms non-discrimination for transgender people.
Legislation confirming non-discrimination for transgender people, stated in clear and explicit language, is imperative to ensure their human rights and to send a strong message about the dignity and safety of transgender people's lives. As an extension to these rights, laws stressing the importance of having non-discrimination guarantees in the workplace are key.
The Equal Employment Opportunity Commission, a federal agency that's responsible for enforcing employment discrimination laws, has taken a position that transgender people are covered under federal law.
In the past, there hasn't been any federal laws. In some cases, it's been a state-by-state basis. Currently, it's still really minuscule protection rights. Recently, President Obama drafted an executive order that pretty much said any federal contractor also has to include non-discrimination provisions within their policies, within their practices for LGBT community.
It is essential for gender identity or expression to be among the list of protected categories in firm-wide non-discrimination and anti-harassment policies. To better educate employees, it should be necessary for companies to incorporate education about gender identity and expression in diversity and equal employment opportunity compliance training programs.
If you're going to truly do affirmative action training, if you're going to talk about non-discrimination, you have to talk about it in all terms. Companies are not only looking at it as a good thing to do, but also a very practical business case as to how to make sure they're attracting and retaining the best.
To improve areas of society outside of the workplace, these policies and training programs must also be extended onto schools, universities, and similar establishments. Discrimination against transgender people is also evident in present family laws.
Our family law is significantly defined around cis sexism. Transgender adults routinely lose relationships with their children when there's family disruption, there's prejudice against transgender people by the court systems, also by the guardian and support systems that are really designed to help families in crisis.
This transformational work includes reviewing and overhauling, when necessary, archaic and outdated laws, and working closely with family attorneys to ensure that transgender parents in contested custody cases don't lose relationships with their children because of bias and misunderstanding.
Legislation concerning health care coverage for transgender individuals must also be established.
Public insurance laws need to include coverage for gender transition.
Without health care coverage necessary to affirm the identities of transgender people, the violation of a human right stated in Article 25 of the UDHR will persist. Everyone has the right to a standard of living adequate for the health and well-being of himself, including medical care. Gender markers on legal documentation also pose significant challenges for transgender individuals, as there is no uniform standard for changing them. Birth certificates trigger many other forms of documentation, including
school records, eventually driver's licenses, passports, social security cards, bank records. Many states have begun to authorize people to change their gender markers when they are living full-time in their affirmed sex and not have to have surgery. It still means that somebody has to change multiple gender markers on different documentation. And you can have somebody who's gotten a passport changed but can't get a driver's license changed, or got a passport and driver's license but hasn't been able to change a birth certificate, and so there's multiple challenges for people in that area.
Legally recognized documents matching self-identity are essential to find employment, to navigate everyday transactions, to obtain healthcare, and to travel safely. Transgender, transsexual, or gender nonconforming status should not preclude individuals from enjoying the legal recognition all citizens expect and deserve. Such legal barriers antagonize the lives of transgender people, since they make social transition more difficult, put congruent identity documents out of reach, and contribute to trans people's vulnerability to discrimination and violence. Legislation that would ease the process of changing gender markers on legal documentation encourages the ability for all to enjoy the right to freely express their gender identity, a human right stated in Article 19 of the UDHR. Everyone has the right to freedom of expression. Governments must also recognize that there is a spectrum of gender identities, and that choices of identity limited to male or female may be inadequate to reflect all gender identities. Therefore, alternate options, such as bigender, genderless, and genderqueer, must be provided. It is essential that governments eliminate unnecessary barriers and institute accessible administrative procedures for transgender people to obtain legal recognition of gender consonant with each individual's identity.
I should say in all of these areas we are definitely seeing rapid change and progress to ensure that transgender people can be fully integrated into society.
Transgender people are one of the most marginalized people in society, often deprived of basic human rights.
Are you saying that you're going to start dressing up like a lady all the time?
Honey, all my life. My whole life I've been dressing up like a man. This is me.
God hates transgender people. My God taught us to love one another. Jesus sought out those who others rejected. I choose to focus on verses like 1 Samuel 16:7, which says, "But the Lord said to Samuel, do not consider his appearance or his height, for I have rejected him." The Lord does not look at the things people look at. People look at the outward appearance, but the Lord looks at the heart.
Societal ignorance, human animosity, and the innate fear of the unknown inspire the stigma which paralyzes the equal human rights of transgender people.
Our dreams are of a society that celebrates, loves, and admires the beauty and diversity of our youth, whether lesbian, gay, bisexual, transgender, intersex, genderqueer, questioning, non-binary, and beyond.
In order to strengthen the transgender human rights agenda, education, the eradication of social injustices, the provision of full healthcare access, and the establishment of fair legal platforms are essential.
I dream of the day when there are no coming out days, not because we're post-gay, but because we no longer presume children are heterosexual or cisgender.
Article 1 of the UDHR states, "All human beings are born free and equal in dignity and rights. They are endowed with reason and conscience and should act towards one another in spirit of brotherhood." This profound statement exhibits an undeniable truth. Despite the profuse differences between individuals, all are connected by the similar characteristic of humanity. To have human rights is to belong to the human race, one in which every individual is created equal. Denying or merely neglecting to protect the rights belonging to other individuals on any basis is denying them their humanity and their dignity.
To imagine a world that is even safer, more just, and more free than we ever could have dreamed before.
Ultimately, human rights are about ensuring the dignity of all people, recognizing everyone's special and unique characteristics and affirming those is the goal.
Will you fight for humanity?